What's going on YouTube? It's your boy Aiden here, just making a little video of some questions I've been getting lately, a lot about my chest. I'm almost at 3 years post-op actually, wow, that went by really quickly. This July 19th will be my 3 years post-op, and I've got a lot of questions recently about my chest and my top surgery, the whole procedure. So I went ahead and shouted you guys out on Instagram and Facebook, and I asked you guys, what are your questions? Because I've been getting a lot, so I figured I should just try to answer a couple in a nice video. What I'll also do too is I'm going to make a little recap video. A lot of questions were about like my specific surgeon and stuff like that, so I'm going to make a recap video also, probably later on this week or maybe next week, just kind of re-going over exactly what I personally went through. Alright guys, so Nathan wants to know, can you talk about getting TES, which is top surgery, before starting T? I don't think people talk about that a lot. So I've heard two different things about getting top surgery before you've had hormones. The first thing is that I've heard that if you get top surgery before you have hormones, you have less of a chance to have some of the fat tissue that's in your breasts to travel around the rest of your body. Some women hold actual fat tissue besides breast tissue in their chest, and apparently, you know, this is kind of, I'm not a doctor, but this is what I've heard, you could potentially have a little bit less fat move to your rest of your body if you get top surgery before you start your hormones. Otherwise, I don't think it really would make a difference. Hey, if you could get top surgery first, I know some people who get top surgery first and then start hormones. I mean, I don't think it really matters. Shane, what up Shane? How long did it take for you to make a full recovery and get back to your everyday activities like working out? And what was the recovery process like? On a scale of 1 to 10, how painful was it? Actually, after I got my bandages off and stuff, to make a full 100% recovery for me back at the gym, I waited an entire year. Now, that doesn't mean I waited an entire year to work out. I waited 6 weeks and then I started running for 2 weeks. And then at my 8 weeks, I started going to the gym, but I was very, very limited on my mobility as well as the weights I could use. I personally knew that my scars are going to be here for the rest of my life. And I knew that going to the gym hardcore right after my 8 weeks when the doctor said I could technically go back to the gym was going to stretch my scars because I'm going to be pulling, I'm going to be grabbing, reaching. I mean, I just felt like I knew that by doing this, my scars were going to stretch. Caden, what's up Caden? What if I'm not defined in the pec area? Would that totally screw up the male contouring either as is or after working chest? Okay, so if you're not defined in the pec area, that's totally fine. Everyone has pectoral muscles, everyone has a six-pack, everyone has these muscles, they're just underneath your skin or layers of fat. Would it totally screw up the male contouring? I don't think it would. But I don't think that they're going to tell you that if you're not, if you're not ripped or something, that you're not going to have a nice chest. I mean, that's just not true. I see plenty of guys out there who are not into working out who have beautiful chests. So I also was told by my doctor, Dr. Yaramoni, that it's not going to be like some huge factor. It's really just going to be like you're going to see the aesthetic of it sooner. That's what he told me. Alright, next up. I can't pronounce this guy's name. Ghost Prince. I'll say that. Would you suggest gaining pectoral muscle before or after top surgery? Again, I think that if you build up some muscle beforehand, it's going to help with your own dysphoria. It's going to make your chest look a little bit more masculine. And I think that you will see aesthetic results quicker if you already have some definition than opposed to having to wait to start working out until you're, a year post or 6 weeks or however long you guys decide to wait. Alright, next question. Orensum. Do you know how do surgeons choose between keyhole or peri-areolar for a small chest? Does it depend on your preference, if the chest is small enough, or both? So yeah, so I know that you have to kind of have a really small chest to begin with in order to have a nice keyhole. You need to not have a lot of loose skin when you're on T. Like I was on T for 3 years, I had a lot of loose, baggy skin, so that bagginess won't retract. So I had to get double incision. It was the only way to look nice and tight in my chest area. Next up, by Saucy Rican. How do you decide in which doctor to go with? Is there anything you would have done differently in your recovery or choosing a different surgeon? I went with the best surgeon for my body type. I was working out, I was fairly lean, I'm white, and I lived in Florida at the time. A doctor who does really good work, who is in Florida, happens to be someone who does really good work, has great scar treatment. I went to Dr. Garamoni, and he was 2.5 hours away from me. It would just be silly to not go to one of the #1 rated surgeons who's 2 hours away from me, and to go to doctor at the time, I can't remember his name, but that famous doctor in California was still doing surgeries when I got mine, the one that Chaz Bono went to, but he's not doing them anymore. So at the time, it would have been silly for me to travel all the way to California when I have a #1 rated doctor 2.5 hours away. So that was a big factor in mine. Also, Dr. Garamoni has done other white boys who look similar to me and has had great results. So I knew that finding a body type like mine and seeing a surgeon who does that body type well is what I needed to search for. From Morgo. Do you ever feel any regret or empty, so to speak? I have no regrets about my top surgery at all. Whatsoever. I don't feel like I'm missing anything. I don't feel empty. I feel freaking fantastic.